Welcome. So today what I wanted to do is just show you a few stretches that can help you with your sciatic nerve problems. So sciatic nerve, it's a very long nerve, one of the longest in the body, and it can cause a lot of issues if it's been restricted, because nerves don't like pressure, they don't like the compression, and that's where we get the pain. So through gentle stretching, we can actually alleviate some of these pain issues that we're feeling. Sciatic nerve, if it's restricted because it comes out from the lower part of our back, our sacrum, we can get an awful lot of lower back pain, sort of cramping pain within our stomachs as well, and also sort of restriction, that tight hamstring feeling that you may feel. Also back of the knee, as it comes down into the tibial and fibular nerves, and then right down underneath the sole of the foot. So we often get, if we've got pain with the sciatic nerve, we get people things like called plantar fasciitis, which is an incredible debilitating pain in the sole of the foot, which has a tendency to show itself in the first time in the morning when you wake up, when you're sort of hobbling along the floor, trying to get to the bathroom or whatever it is. And it's not until you do some stretches and things that you can alleviate it. So, and the thing with plantar fasciitis, people will probably concentrate on focusing on the foot. Now, what we actually want to do is look at the fascia and the nerve train that's coming from the foot up through the Achilles, through the calves and the deep sort of calf muscles, the tibia at the posterior, and then up into the hamstrings and up into the glutes as well. And actually, if you follow that train of fascia, it goes all the way up to our spine, up to the back of our neck, and then sort of around to this point here of the frontal bone. So you can imagine if that sciatic nerve is tight, it's also coming up round up to our back and into our neck and headaches and things. So it's a really good nerve to stretch. So here we go. So the key with stretching is to not actually push yourself. If you push and stretch too much, you can probably cause more damage. So be really good and be kind and listen to your body through this. So it's really great to try and bring the stretch for your breath. So with the diaphragmatic breathing, we've talking up in the belly, let our bellies hang out and really relax the stomach muscles as we breathe in, because that will allow us to really find and deepen our breath, which when we do, we breathe more into our lower back, that can start helping that too. So don't overwork, breathe through the stretch and recognize when your body starts to resist, just back off a little bit. Okay, so right, here we go. I'm just going to start off with a few of the ones. So it's working the piriformis as well. So I'm just going to tilt this backwards. There we go. Right, okay. So what we want is have your legs sort of knees bent and your feet on the floor, and have your back nicely supported on the ground as well. So sort of pulling up your navel, so you're really sort of feeling your lower back rooted to the ground. So you're going to bring our legs up, and then the leg that you actually feel where most of the discomfort, let's start off with that one, and we just bring our ankle over our leg, the knee of the opposite leg, and you might just start feeling that stretch already, which is good. So if you do, let's just keep breathing and feeling that, and just kind of keep letting that relax. And then if you want to start to increase that stretch, bring your hands, so like one hand loop between both the legs, and then the other leg round to the outer side of the other one. And then interlace your hands behind, so around your hamstring, and just bring that back as well. So just feeling that stretch, and you should hope you start feeling it all the way around in that lower back there, and lower back into your sort of bottom. It's just feeling that. Taking a nice deep breath in and breathe out, just let it go. So it's just really key is allowing your breath to connect to the point where you feel the restriction, and as you breathe out, you're letting that stress and that pain go, and you might be find like a slight tingling or warmth coming on from that. Okay, so if you feel this is where you need to be and stay with it. If you feel like you need to do a little bit more, bring your hands to the front of your knee and just interlace it there, and then just pull it a little bit more. So you're really bringing your hips, your legs towards you, but you're keeping that lower back nice and connected to the ground still. And just breathing again into that space, into that whole stretch. But again, don't feel like your body's shaking and pulling into that stretch. Just ease off slightly and then breathe into it. So the key for stretching is not there so much the depth, it's more the length that you can hold it for. Okay, and make sure you do the opposite side as well, so you feel the balance of the body, so you can do that again here. Okay, so I'll just show one side as well, but make sure you do that side too. Okay, and then the other one, it's like we're trying to really work the sciatic nerve. So we kind of bring our toes, point them down, so we're shortening the muscle, and then we tilt the toe up, and we bring it up, like so. Feel that stretch. And then tilt our toes back down, and bring our legs back down like there. And then tilt back up, and then come back up as well. My foot's coming off the camera, but I think you'll get an idea where I'm going. And then tilt your toes back down, and then bring it back down as well. So this is kind of a bit like flossing the sciatic nerves. It's really sort of opening and stretching, just trying to activate the muscle. So again, make sure you do that on both sides. So if you want to increase the stretching, because you feel like you could do a little bit more, then come onto your front, and your hands and knees, okay, like so, and then slide one back, and the other one forward. So I'm just bringing my right leg forwards, and my foot here more level with my hip, and my lower leg will shuffle along a little bit more so you can see my whole body. So that's, make sure you look about, you've got the alignment going on with your other leg, so it's nice and straight. You've got your hip in alignment with your ankle, and just find that there, just kind of feel it, let your body sort of like soften into it, because we want this to be relaxing, we don't want this to be stressed and forward. And don't forget to breathe. Now it's a time to let the belly out, and just slowly allow yourself to come down onto your elbows and your palms. Just feeling that breath. Now really try and bring your breath into your lower abdominal here, but also see if you can try and bring it into here too. Really try and expand that breath, and as you do, you'll probably feel it all around the glute area and your piriformis too. And then if you get, if you want to, you can just get lower and lower, and just breathe. And then you can hold that for a minute or longer if you wish. Just hold that there. Well, if that just feels a bit too much, just keep yourself here, like that. But what that will also be doing is doing a beautiful stretch here on your hip flex, on the other leg, which is key as well, because if these are tight, it's going to be pulling and everything onto our sciatic and our sacrum joint here. And so opening up the whole of the hips, front and back, will be really key to releasing your hand with the sciatic nerve. Okay, so again, make sure you do that on both sides. And then when you're feeling more keen, let's do the downward dog. So coming up, put your hands there, but coming up back up onto your feet. Now you might not be able to get your heels down straight away. That's absolutely fine. Don't stress and push yourself through this. So if we don't, a nice way of warming up to it is doing like a pedal push. That's how I imagine it. So you come up onto your toes on one, and you bring your heel down on the other. So it's like a step up, step down. And a nice way of doing it is actually to breathe in when you do it and breathe out. So as you breathe out, you do that lovely stretch. So to breathe in, in, and just find that, taking that stretch backwards and forwards, up and down, that's it. Until eventually you feel yourself, you can allow your ankles and your heels to come down. And you should feel a wonderful stretch coming up from your feet, from your calves and your hamstrings. This is stretching all the fascia, the sciatic nerve, and hopefully an element of the glutes as well. That's it. And then if you want to make that even stronger, plant one of your weight on one of your feet, and then bring the other one up. That way, Put more pressure and weight and strength and stretch into the leg. That's it. And if you're there, get flash and bring our other leg forwards, like so. I think this is called a runner's lunge. So we've got our starting point here like that. And then we can actually start feeling a lovely stretch. I'm going to just alternate my legs so we can see it properly. You should start feeling a lovely stretch within those hip flexors there, which again can start affecting the lower back and the sciatic nerve. And just sort of breathe into that. Now, if this is too much, you can bring your knee down. You just plant your foot flat. And then you can rest. You know, let's not make it too hard on ourselves. Let's enjoy it. If we enjoy it and we feel the benefits, we're more likely to do it more often on our daily practice. So, that's it. Feels good. And then you might want to rock, just find more strength and stretch. And that's just a few techniques that you can do on yourself on sort of every day, really. So especially if you struggle with the old plantar fasciitis, so that'd be something to do morning and night. Just really sort of start stretching, elongating that sciatic nerve. So any questions, by all means give me a call, and please let's see, hope that helps you an awful lot more. All right, take care, see you, bye bye.